There's lots of things in today's society that tell us what to expect during the process of labor. There's viral videos in the media, there's TV shows, and there's even celebrities that give us a little glimpse into what they've gone through. But what really is the process of labor? What can we expect as moms, soon-to-be moms, or even partners? What can we really expect when someone we love or even ourselves is going through labor? In this video, I'm going to explain a little bit about pre-labor and the 4 stages of labor. Pre-labor is when the woman's body is preparing to go into full labor. Now, pre-labor is not to be confused as early labor. And the truth of the matter is that there's a very fine line between those two, and no one really quite knows how to pinpoint when exactly labor begins and pre-labor kind of fades into it. Pre-labor is when the woman's cervix moves forward, starts to soften or ripen, and even might start to dilate. There's lots of things that go into pre-labor. Just body changes, hormones, cervical mucus. There's lots of things that are going on. And it's hard, like I said, to know that fine line between pre-labor and early labor. Now, early labor is part of the first stage of labor. It is part of a 3-part stage. Early labor is the first phase, and then there's active labor, and lastly, transition. Early labor is when the woman starts to have contractions. Her membranes might rupture or her water will break. At this time, contractions start to become a little bit regular. They're not very strong, so you might not actually feel them, but they'll be there, and you might even see your stomach contracting. You also might have some bloody show, which is a tinged mucus, which means that your mucus plug has come out and your cervix is starting to continue to ripen. During early labor, it is important to stay calm and to know that it's no time to rush. In a lot of movies or things that we see on the internet and in social media, if a woman's water breaks, immediately the instinct is to freak out, to get very excited and, oh my goodness, oh my goodness, oh my goodness, it's happening. And that's very, very true. But the best thing to do is take a deep breath and to slow down. Early labor is the best time to keep mobile or even relax. This is a part of your labor that you will really want to just focus in and understand that this is the beginning of the process. It's no time to overreact, although it is very exciting that this is the beginning of the process of labor and when you will be holding your baby soon. It doesn't mean that it's going to happen within the hour. And I think that's a big confusion with the way we see things in movies. A lot of the labor process is edited out in movies, and it's difficult because then we don't really know what's happening. That's early labor. After early labor becomes active labor. During active labor, contractions become consistent and consistently progressing into more activity, basically. The contractions become stronger, so you might feel them a lot more. You might really be getting a sensation in your cervical area. You probably need to stop. And that's why it's really good to stay calm in early labor, because that way any comfort techniques that you've been practicing or you've learned about, you can use them during early labor and even continue to use them in your active labor. Active labor is when things start to really progress. It might feel like this is going on forever, but don't worry, it's only a few more hours, hopefully, that you'll be holding your baby soon. After active labor comes transition, and that's exactly what's going on. Your body and yourself are transitioning into the second stage. It won't be long till you're holding your baby. So it's really important to know that this time, even though it's hard, it can be conquered. You can get through this. For myself personally, I've had 5 babies, and for 4 of them, I went through this stage. For one of them, it got cut cut short because I had an emergency cesarean. But for my other ones, I went through full transition. And that time for me was the hardest time of my entire labor. Transition is, like I said, when you're transitioning from one stage to the other, but it's also when your cervix is completely opening to finish to being ready to have your baby. And it's also when your baby is continually lowering to get into the optimal position to be birthed. So you might have a lot of back pain. This is where you might feel like you can't keep going. For a lot of women, transition is where they kind of give up. I can't go on. So that's why it's important that if you are going the non-medical route, that it's important to have a mindset of determination and to know that you can do this. You can conquer this pain, and it's only momentary. A lot of women, though, they do prefer to have pain medication, and there's no judgment. There's nothing wrong with that. And this is probably the time that you would want to have it, or even during active labor. So that's something to consider, that even in this stage, it might not be the best time to have pain medication. After transition, you go into your second stage of labor, which is pushing and birthing your baby. So pushing can go for minutes or it can go for hours. It just depends. I've had babies that I've pushed for 10-15 minutes, and I've had pushing times to go to about an hour. There's lots of women that go over that time. It's important to listen to those that are caring for you. I've been very fortunate to have very supportive people around me during my pushing time, where they help me to stretch or to learn how to breathe, and different things like that. So be on the know of who you're going to have with you, and know that it's important to have supportive people around you during this time. Once your baby's birthed, you'll go into the third stage, which is the birth of your placenta. Now, hopefully you wouldn't have tore, or there wouldn't be any complications, but usually they let you hold your baby, and then they kind of push on your tummy a little bit, and it hurts quite a bit. If you can imagine, your uterus went through a lot, so for anything to be pushing on it is not comfortable. And then once your placenta is birthed, they'll check it to make sure that it's fully intact and there's no complications or problems. And then there's your recovery, which is the last stage. Recovery is usually just a few hours. They basically want you to have your body to stabilize. That's what recovery is really. It's not to be confused with postpartum recovery, which may take weeks and months. So recovery after, in the sense of labor, is that it's your body stabilizing. So, and there's lots of things that can go into that. I know for myself, I had body spasms, my legs, my arms, I was shaking, and it was very weird. And that only happened with my daughters, actually. So, and the other thing is that if you do have a cesarean, these stages are kind of different. You might have a longer recovery time, or the placenta might, the time for it to get birth might be different, and different things like that. But it's important to know that anything and everything that happens during this time is usually normal, and it's important to know the process before you go into it. And even if you're helping someone, to know the process, to know that there's going to be times that are a little easier and times that are a little harder for them to go through, and even for you to see them go through. Altogether, like I said, there's 4 stages. There's your pre-labor, then you go into labor, which you have early, active, and then transition. Then there is the second stage, which is your birth, which is pushing and the birth of your baby. Then after that, you birth your placenta, and after that, you recover. So thank you so much for watching my video on the stages of labor. And like I said in the beginning, it's hard to really understand and know what to expect with today's society. You know, there's so many viral videos of women having their babies in their car, or right when they get to the hospital, the baby just kind of pops out when they're sitting down in the wheelchair. Or, you know, even movies. I mean, I can remember there's a movie with Drew Barrymore, and, you know, her water broke, and the next thing you know, she's screaming, and everything was happening so quickly. And so it's hard to really have a grasp of what to expect. And that's why I think it's very important to be informed and to understand this process. So thank you so much for watching again. And if you haven't already, go ahead and hit subscribe and follow my journey in becoming a doula. And if you have already, thank you so much. I love you. Thanks again. See you soon. Bye.